Hello and welcome to today's class, a clinical case discussion class with a focus on differential diagnosis, addressing what is happening in your practice nowadays. What's going on with the patient? What is this patient's profile? And how can you approach your patients differently? Both those who are already under your care and the new ones who are coming in. For those of you who don't know me, I'm Andréa Melo, a dentist graduated from ERG. I have a master's degree in material science from IME, a doctorate in restorative dentistry from ERG. I completed postgraduate studies in prosthetics, and I'm here to teach you dentists how you can become a reference in your region, increasing your revenue with a great deal of integrity through differential diagnosis, treatment, and control of bruxism, this problem that is growing the most today in our country and around the world. With this, you have the ability to become a reference in your region, doing things differently from most dentists. And this is for you. Even if you don't charge for consultations today, or if you work with health insurance plans, this is for you too. The patient is already experiencing this kind of clenching, this kind of problem in your chair, and I'm going to show you how to address it, this differential approach. Here is one of our events where we are sharing this knowledge, and I want to bring you the idea, the certainty that today the patient is 360 degrees. What is a 360 degrees patient, Andre? What is 360 degrees dentistry? Maybe you haven't thought about it, you live it. I know what a dentist's life is like. I'm a dentist. I really believe in the teacher who teaches, who applies, who works, who sees patients, who lives the day-to-day grind, who knows life as it really is. I know life as it really is. I see patients in my office for over 20 years, and I know exactly what you go through. And we were trained to understand that if a patient clenches their teeth, you give them a night guard, restore a canine tip, establish at most an occlusion, and move on with life. If it breaks, they pay again, but often they don't. It creates discomfort. You lose the patient, and this might be happening to you today. Train to look inside. But I brought a study that clearly shows that this work on the effectiveness of occlusal splints in treatment with bruxism is a systematic review. What is a systematic review? A systematic review is a compilation of a number of qualified articles that are found in the Formimed library, which is a highly reputable library in the medical field. And these systematic reviews are summaries of articles that can be compared using a certain metric within a specific methodology. In short, that's what it is. This systematic review then brings together 22 identified studies that were able to be included in this work about the effectiveness of occlusal splints in the treatment of bruxism. The result, without further ado, the result is right there. Look, the conclusion. There is not enough evidence to determine whether occlusal splint therapy for the treatment of bruxism offers any benefit compared to no treatment. Number 1, no treatment. Number 2, other intraoral devices. Number 3, TNs, which is another muscle therapy. Behavioral or pharmacological therapies, in other words, the study, the review, proves that there is no bias, clearly stating that you have to give your patient an occlusal splint and that it is the best treatment. Now, I'm going to go beyond that. All these approaches from this systematic review and from what is in the literature today are talking about consequences. What is the consequence? Protecting teeth, relaxing muscles, or treating sore muscles, that's what the tooth is for, and that's the consequence of clenching. Now, my question is, what about the cause? Where is the cause of bruxism? How do you treat a problem without knowing what the source of that problem is? And that's exactly what I want to bring to you. At this moment, if you understand what I want to explain to you in today's lesson, you'll set yourself apart. You know what it means to stand out from the crowd? That's what I want for your life. Because today the patient is 360 degrees. Today we already have dentists who have understood this. These are the dentists in this photo. All of them with my book in hand, explaining exactly what differential diagnosis, treatment, and control of bruxism are, step by step. Andrea, that's so cool. I didn't know you before. I'm seeing you now. I want to tell you that I'm in a very important week. You might be joining in this week now through this live I'm doing here publicly, but we are in a week that is the Advanced Dentistry Week. It's an exclusive event for dentists which takes place online, but it's not here on my social network. It's an online event that you need to register for. It's free, but you do need to register. So if you're not registered for the Advanced Dentistry Week, now is the time. Down here or in the link in my bio, you can click the link and register for free. You will receive the exclusive classes, the lessons where I explain and break down this step by step. Today, I'm going to discuss clinical cases from my students, but if you want to receive this event, if you really want to become a reference dentist in your area, want to increase your revenue with integrity, want to be that dentist, even if you don't charge for consultations or if you accept health insurance, type the word bruxism so you can register here in the comments, okay? So let's continue. You will receive it. Just enter your WhatsApp number, your best email. Don't use the clinic's email. Be careful with scams. There are people trying to impersonate me, selling a super cheap course and claiming it's me. That's not true. So pay attention to the numbers, to the number that contacts you. You will join a WhatsApp group, and that group has administrators there. Only accept messages from the group administrators. So you don't fall for the made-up story of a super cheap course, a special promotion made just for you, because that's not me speaking. So I'm going to bring you here a series of scientific articles, as you can see in the screenshot of this image. All of them are based on science applied to clinical knowledge. So in lesson 1 of the Advanced Dentistry Week, this exclusive event, I explained the 4 reasons why you should become a reference in bruxism in your region. Any area of dentistry today needs to address bruxism, and I will explain why in lesson 1. In lesson 1, when I talk about the 4 reasons, you will understand the huge demand we have today for bruxism and the lack of qualified professionals. That's what we call opportunity. Opportunity is when you have a huge demand, a pent-up demand, a demand that exists, and there aren't enough qualified professionals to meet that large demand. Isn't that interesting? This lesson was released yesterday, but I'll give you a quick summary. Still, I would like you to sign up so you can receive lesson 1 and watch it in full. The first reason is that bruxism is the fastest growing problem in our country. That's right. In Brazil, about 40% of the population suffers from bruxism. That's a lot. That's a lot of patients. Meanwhile, on the global stage, the average is almost 30% of the population. In other words, in Brazil, the diagnosis of bruxism is higher than the average in other countries. Isn't that interesting? Repressed demand. A number of patients are left without a solution. But in Brazil, we have about 426,000 registered dental surgeons in the country. In other words, these are registrations from the CFO, the Federal Council of Dentistry, data from 2025. This number makes Brazil the nation with the largest number of dental professionals in the world. What does this mean? Why did I bring this data to you? Maybe you're struggling in your city because of high competition. In the past, some things like, oh, I do aligners, I do veneers, that used to be something new. Today, it's not anymore. Today, everyone does it. Nowadays, you sometimes have a specialist on every corner of a city, depending on the area where you live. So this is the moment for you to understand that out of those 426,000 dental surgeons, very few, and I'd say not even 5% of that number, actually understand real bruxism treatment, differential diagnosis, treatment, and management. So if I have a huge demand and a very small supply of professionals, then I have an opportunity. This is the number that represents your opportunity, very, very high. 200 million inhabitants in Brazil. If I work below average, the WHO's report was 40%. If I work with a number of just 30%, let's put it below the average that the WHO is talking about. That's 60 million Brazilians for 400,000 dentists. What do you think? 400,000 dentists, but they don't, not even 5,000, not even 5% actually know how to be a reference in bruxism. So it's a gigantic opportunity. And what are people searching for on Google? Andre is saying this, but patients don't search for bruxism. They do. Do you know why they do? I'll tell you. The chart I brought, the blue one, is for the word bruxism. Search term on Google, bruxism. And the yellow chart is for clear aligners. That is aligner, a linea dente. I didn't even just put the brand Invisalign. I put clear aligners because that would include any brand. Look at what happened on the chart. At a certain point, the lines crossed and bruxism surpassed the line for clear aligners. And in 2022, bruxism also surpassed the line for dental veneers, which is the search term shown in red. What does this mean, Andre? It means that people are typing the word bruxism into Google to look for qualified professionals and they're not finding any. That's the truth. And the question is, do you want to keep banging your head against the wall, or do you want to become a reference in something that currently has no reference? Think of 3 dentists in your area. Just three from your city. Which of those 3 dentists are known for bruxism? I'm not talking about TMD. I'm not talking about orthodontics either. They're different things. TMD is not bruxism, and I'll explain that to you. Orthodontics isn't bruxism either. Out of your whole city, whether it's a big city or a small town, I wanted 3 names. There aren't any. You can't think of those names. Man, that guy is really good at bruxism. Let's send the patient to him. He knows how to make a differential diagnosis. So take a look. I expanded the chart, moved it forward a year to 2023. The blue line went up even more, which represents the search for bruxism. Guys, what does that mean? That it's going to keep rising more and more. Why? Because bruxism has several causes. We're going to talk about differential diagnosis. There are several causes. However, with the lifestyle we live today, the cause of bruxism is becoming more and more established and is adding up. So if there's a respiratory cause, we'll talk about diagnosis. If there's a respiratory cause, it adds to a behavioral cause, and that leads to more evidence of bruxism in our chair. You're seeing fractures like this appear. You're seeing crowns coming loose. You're seeing teeth being lost, pain, hypersensitivity, dental chipping. All of this is happening. The question is, do you want to be the dentist who just puts on a Band-Aid, puts a little resin there, restores a tooth, sometimes even has to do an extraction and an implant, unfortunately, because of a longitudinal fracture? Do you want to be just another run-of-the-mill dentist? Or do you want to be a reference dentist who knows what they're doing and is truly providing the right treatment for this patient with the correct diagnosis and the right approach? My question for you is, who are you right now in today's world? There's a myth that you should only deal with bruxism if you're a rehabilitator, an oral surgeon, a TMD specialist, or an orthodontist. That's not true. Do you know why? All specialties can and should include bruxism in their clinical diagnosis and in their daily clinical treatment routines. It's common to everyone. You don't need to refer the patient. I know that most of you make a mouthguard and give it to the patient, or even refer the patient to have a mouthguard made. But that's not the goal. Especially because I just started the class by showing that the mouthguard is not the only treatment, that there are several types of mouthguards, and that there is a methodology for treating bruxism. And we'll get to that, but hold on. We're still here breaking down the reasons. And this myth is so untrue that, for example, if you receive a patient like this one with pain or sensitivity, sometimes you're an endodontist, and the patient has excessive sensitivity, dentin exposure, or sometimes even necrosis. Why? Clenching can cause necrosis. It can even cause delamination of the cementum. This is becoming more and more common. You can only see it on a CT scan. New issues are emerging in dentistry because of bruxism, cementum delamination. And then you, as an endodontist, you look and see an exostosis, which is also a consequence of clenching. There are fractures, there is dentin exposure. And so I want you to understand that the patient is more than that. And just looking at the evidence of bruxism is not the same as making a differential diagnosis. And if you're still with me in this lesson up to now, you already deserve congratulations, because you're already here believing that there's more to bruxism, that there's more than just the mouth guard. So this is a moment I want you to understand. This is your moment. This is your turning point, your moment to understand that you're not going to do more of the same and that you're learning to stand out. In lesson 1, I explained how all specialties, whether I'm in aesthetics, restorative, endodontics, implants, orthodontics, or general practice, can and should address it. Bruxism in your practice, and how pain, headaches, sometimes a pain that seems to have a dental origin actually doesn't. It's a muscular pain related to the clenching that this patient does. So, bruxism and its correlations. This is truly the new foundation of dentistry. If you haven't gotten into this yet and you're here, I really want to congratulate you. And I want you to understand once and for all that many times you might even be a reference in your region, in your field. However, if you don't learn about bruxism, you're going to be left behind. Sooner or later, you're going to be left behind. Because more and more patients are showing up with occlusal overloads caused by bruxism. And I don't want you to give up your specialty, not at all. I want you to add the cherry on top, which is bruxism. So look how interesting this is. I talked about necrosis. I talked about endodontic necrosis caused by bruxism. I talked to you about occlusal overload, cement delamination, and I brought an article here with the following conclusion. Occlusal overload caused by bruxism or by an improper occlusion, and even more so if combined with bruxism, which is the combination of these factors, in the first year of an implant are the main causes of fracture and implant loss. Look how interesting that is. Maybe you're an implantologist and you think, oh no, I only do surgery. I don't want to get involved in this. But is your implant at risk? And it's not just me saying this, the literature has already proven it. In other words, for this to become part of the literature, it's been happening for a long time. There have been reports about this for a long time. So this is already well established. Occlusal overload, inappropriate occlusion, and the combination of these factors cause early implant loss. And losing an implant in less than a year is a real headache with the patient. You end up in a crossroads. It's awful. You're put in an unpleasant situation. And I'm not even just talking about the financial loss, because you lose money. You're not going to charge again if the implant fails. The patient will look at you and you'll have to go through the whole process again. New implant, reimplantation, removing the failed implant. There's a sense of failure, a sense of defeat. It's a failure. And how does the patient feel? They feel terrible in this situation. Another problem too, if you're an endodontist. Maybe you're thinking, no, I only do endo. But besides endo being a potential, right? It's a potential for differential diagnosis, because a lot of people come to you because of pain and you have to make the diagnosis. And bruxism is part of the pain diagnosis. That's the point. If you don't understand bruxism, you're not seeing the whole picture. You're only looking at the primary endodontic issue. And trauma, occlusal overload, it can indeed cause necrosis. Cementum delamination, necrosis, cementum delamination. And the third point I brought up for you is microcracks, which increase the degree of reinfection, infection, and retreatment. So to prevent post-endodontic treatment complications, I need to reduce this overload to truly ensure the structural integrity of the tooth. So bringing health, increasing revenue with integrity, and the conclusion is that intense bruxism is capable of causing apical periodontitis. There you have it. This is a super important point, and it's published. A 2022 article, Apical Periodontitis After Intense Bruxism, a case of intense bruxism. You might not have known all these facts I've given you so far, but now you do. And the big question is, Knowing this, how can you go to sleep and see patients the next day as if everything were the same? Knowing it's not, knowing the patient is clenching, knowing this is the new world order, the new reality. The new reality in dentistry is the patient who clenches while sleeping, the patient who clenches when awake, the patient. How are you going to deal with this as a healthcare professional? I usually joke about it, but it's a joke that's actually completely true. If you don't take care of your patient, if you're not a healthcare professional who cares for your patient, there's no point in having a practice, in seeing patients in a clinic, in being a dentist. If all you want to do is sell a mouth guard and say goodbye, I joke, you might as well open a shoe store. But it's because you are a healthcare professional and you need to be equipped with this information. Andrea, I understand. And why is the prevalence of this rising so much? Is it just behavior? No, it's not just behavior. There is also a relationship between sleep apnea and bruxism. Brazil is the third country most affected by obstructive sleep apnea. Both disorders, bruxism and apnea, are consequences of fragmented sleep, or rather they result in fragmented sleep, actually. Look how interesting. This is an article from Estado de Minas that invited me to talk specifically about the relationship with obstructive apnea, and there is a higher risk of diabetes type 2. There's a 63% increase in the risk of diabetes in patients who have obstructive apnea compared to those who don't. And there is bruxism secondary to obstructive apnea. How does that work? The patient's oxygen levels drop, the brain thinks it's dying, releases adrenaline, and the patient grinds their teeth. And then, is it just behavioral? No. There's a respiratory study involved here. What are the causes in this study? That's another issue. But I want you to look beyond the mouth guard. I want you to look beyond just saying the patient is stressed. It's not just that. And look how interesting. 64% of the people participating in this advanced dentistry week have already given an occlusal splint to a patient with bruxism. Most of the time, you've already given an occlusal splint, or sometimes you've referred someone to make an occlusal splint. What does that mean? It means that only 7% have never given a splint to their patient, or never referred them. That means that's what we learned. I understand you because I learned that way too. But today, there's more. And the third reason is that you don't need expensive machines or new software. Whatever area of dentistry we go into, we have to invest. We know that. It's equipment, it's instruments. There's always something new to buy. If there's a consumerist profession, it's dentistry. There's a lot of gear. So bruxism is the only area where you invest zero. You start out investing nothing at all. Isn't that interesting? So that's a big reason for you to understand there's nothing to wait for. Many times you invest in expensive equipment, you buy expensive equipment. Is that important? It is important. I know it's nice to have equipment. I have a lot of equipment, but that's only going to give you a return in the long run. In the long run, you'll end up paying for all that equipment, often without making a profit. And with bruxism, it's the opposite. It's going to give you a profit in the short term. And I'm going to explain how. I'll explain how. In lesson 2, actually, tomorrow's lesson. Of Advanced Dentistry Week, I'm going to show you how to increase your revenue without investing in anything expensive, in an analog way, without needing a scanner. If you don't have a scanner, don't worry, okay? Don't stress about needing a scanner to treat bruxism. I'm going to teach you this now. Now pay attention. Look at the problem I just gave you, that I'm about to give you now. I told you that 64.7% have already delivered an occlusal splint, and some have done it sometimes. So what do I want to bring to you? In the case of apnea, when the patient has apnea, which is the issue of airway obstruction and low oxygenation during sleep, the Michigan bruxism splint, the flat splint, is contraindicated. Why? Because it moves the jaw a little further back, and this actually causes the patient's oxygenation to decrease. Wow, Andrea, that means I gave out several splints without knowing the patient had apnea. I know, I've done that too. Now, what am I bringing to you? I'm bringing you the differential diagnosis. It's the differential diagnosis that, besides increasing your revenue with a lot of integrity, actually helps you take care of your patient. So when I talk about integrity, it's because it's not just about money. It's money earned by taking care of patients the right way. And that's a reason I'm going to give you now. The fourth reason is how much easier it is to close treatment plans for patients who come back. What do you mean, Andre? You'll see that after the differential diagnosis I'm going to teach you, you'll have a completely different approach. And the patient connects with you. Once they connect, they come back and you close other dental treatments. Let me explain. If you don't charge for consultations today, okay, 54% of the people here don't charge for consultations. There's nothing shameful about that, okay? I don't want you to be ashamed of anything. I want you to understand where we are today in dentistry in general and where we can get to. And 53% of the people here work in their own private practice. What does that mean? It means you attract patients so you can close the deal right there in a consultation about what they need. I want to point out to you that a differential diagnosis of bruxism allows you to increase the value of that first contact with the patient. How are you going to do that? Tomorrow in lesson 2, I'll show you how you can introduce complementary differential exams done in the office into the differential diagnosis, which increase the average ticket and actually determine whether the patient has apnea or not, and whether the patient has nocturnal bruxism or not. That's the cherry on top. Okay, Andre understood. So if you on average see 1 to 5 patients, 1 to 5 patients per day, 1 to 5 per day, which is what most people see, or 6 to 10, let's say 1 to 5. And I'm saying if you work on average 5 times a week, 4 times a week, and you see up to 5 patients, at the very least, you're seeing 20 patients per week. Look how interesting that is. If you broaden your perspective with these 20 patients, and I'll bring this up in today's discussion of clinical cases, bringing in this differential diagnosis that increases your ticket and gives you a broader view, just imagine how much revenue you're missing out on by not considering the differential diagnosis. And imagine how much more impact you could be having on other people's lives. I'm going to show you now through the discussion of my students' clinical cases using a differential diagnosis approach. I know that we have a very technical background. I know that we have a lot of it. A feeling that we need to deliver something to the patient, right? That's why it's sometimes easier to sell a mouth guard than to talk about bruxism treatment. Sometimes it's easier to restore a tooth because that's our comfort zone. That's what we learned. Now, I'm going to teach you this entire methodology tomorrow in lesson 2. So I really want you to be in lesson 2. I've summarized lesson 1. If you can watch lesson 1 today after this live, great. Watch it on fast forward. But tomorrow I'll also present you with a lesson breaking down this methodology, which is differential diagnosis, treatment, and control of bruxism, DTC. And here is the exam, the complementary differential exam that I'm going to explain to you. The differential diagnosis has 4 stages. The 360 form, which consists of the right questions, questions validated in the literature, a compilation of important questionnaires, and questions that will lead you to understand the patient's routine and which relevant diseases the patient has. Tomorrow, I'll explain all of this to you. Second, extraoral and intraoral evaluation. How do you perform this extraoral and intraoral evaluation? Tomorrow in class, I'll explain it to you as well. And the differential complementary exams, which are the cherry on top when it comes to increasing revenue. I'm going to show you here in practice some differential complementary exams that have already been done. And tomorrow, I'll show you how to perform this differential complementary exam, how to implement this in your practice. And the 4th pillar is closure and support. Let's go. This here is a template I give to my students so that we can discuss their clinical cases. So I brought real clinical cases, okay? Real clinical cases where the patient is, often the dentist didn't even charge for the consultation, and the dentist offered the patient a differential diagnosis. The patient accepted, and I'm going to show you this in practice. The patient, Rodrigo, 34 years old. How did he arrive? What was the main complaint? Tooth wear. He came to me for rehabilitation. He came to Simone for rehabilitation to get a restoration done. And the patient found the diagnostic wax-up exam interesting. What exam is that, Andrea? You know, when you're going to do a root canal or a restoration, don't you take an x-ray? When you take an x-ray, what are you looking for? I want to see what I can't see with the naked eye. I want to see bone. I want to see the periodontal ligament space, periapical lesions, bone resorption, marginal adaptation. Those are the findings we see on the x-ray that we need. The diagnostic wax-up exam reveals the nocturnal findings. What kind of movement does this patient make with their teeth at night? How do I know if it squeezes or if it squeaks or if it does both? So this differential diagnosis, how do I know the intensity of this bruxism? It's the x-ray of the night. It is the examination of the diagnostic plate. And Simone, even though she didn't charge for the consultation, she charged for the exam. How much was it? 500 rays. You already increased a ticket of 500 rays. Result of the plate from the diagnostic plate exam, severe centric and eccentric bruxism with possible gastric influence. She hasn't done the saliva test yet because she hasn't bought the strips. One detail besides that, we can enhance our differential diagnosis. We can and should when there are signs of erosion, when the patient shows signs of erosion. Here's a case of overbite, a case with small fractures that bothered the patient, these lower fractures when he spoke. A case that very likely, and I'll go deeper into this tomorrow in lesson 2, I'll explain to you what the intraoral Mallampati exam is. This case here, for example, very likely this patient snores and has some level of apnea. Let's take a look at this. And what happens? We have the questions, the ideal questionnaires, because this will give me a score of the likelihood that this patient does or does not have it. Looking at his diagnostic splint, what does he do? He clenches. I published this diagnostic splint exam in 2019. Since then, we do it for 100% of patients because I don't know what they do at night. And now I clearly see very few tracks in this patient. The splint was completely red. It doesn't come off with water, only with friction. And so we see a small track on the canine and more clenching and a fading of the ink. This fading of the ink was what she wrote here, of possible gastric influence with signs. So if you look closely at that molar in the back, you can see there's enamel wear. What does that mean? It could indeed have a gastric influence. Is there any kind of apnea? No, there is no apnea. Oh, interesting. Even though he has a deep bite and the jaw is a little further back, he doesn't have apnea, but there could be an erosive process involved. What does that mean, folks? It means that there is a methodology for reading this exam offered in the office. Which are the differential complementary exams? There are two, the polysomnography exam and the diagnostic splint exam. These two exams are essential for you to assess the clenching pattern, the movement pattern, the amount of this movement, whether it's mild, moderate, or advanced bruxism. There is a methodology for reading this exam, and the polysomnography exam is the same thing. These are two exams you can offer to increase your average ticket, and patients easily connect with these exams because they want to know what kind of patient wouldn't want to investigate the problem they came in for. So this makes you stand out. I'd like you to listen to Andrea's story because Andrea's here in this setting. She's in her office. You'll find her. But Andrea didn't used to book appointments. And look how interesting what happened to her life, to her practice after she internalized this methodology and started offering it.
So patients would come in with these complaints. Sometimes some would mention them, others wouldn't. And then my diagnosis was always a mouth guard. But after I learned about Dr. Andrea's DDC method, even though I wasn't charging for the initial consultation, I went from 0 to 450 rays because now I'm charging for the diagnostic mouth guard. And the full diagnosis, which includes polysomnography, now goes from 0, since I didn't charge anything before, to 1,350 rays, with the entire diagnostic package included. This part of the diagnosis, I honestly thought it wasn't possible to close it in the first consultation. But there's so much knowledge that we acquire, and during that first consultation, we share all of it with the patient, that the patient becomes convinced that this diagnostic stage is extremely important and doesn't even question it. They don't even question what comes next. They say, let's do the diagnosis. Let's first find out what you have, and then we'll come up with an individualized and personalized treatment plan for you. The methodology, the materials that are used aren't anything extraordinary, so they're straightforward things, simple, not expensive, and you can add value to this exam. So, from general practitioners to specialists, I think it's really worthwhile to include this in your clinical routine because it will help with the final result and the overall delivery of the treatment for the patient, especially if it's a patient who needs more extensive treatment, where you want to develop a diagnosis and ensure the patient has long-lasting work in their mouth, which I think is really important. For example, in the 8 weeks I've been taking the course, I've already applied it to many patients. So the methodology is straightforward. I binged the first classes about how to make the appliance, the instructions I need to give the patient, and it's already applicable. In less than 8 weeks, I had already recovered all the money I invested in the course. So it was an investment that was really worth it. And today I feel like a reference in my region because patients come in and are amazed by this whole methodology we're applying here. And that makes me extremely happy because that's what I've always sought throughout my clinical career, to deliver this to my patient in the form of a treatment that will help them have a better quality of life.
Look, sometimes, as I said, you look at Andrea in this situation and say, but she didn't charge for consultations. She didn't charge for consultations. This increased the ticket price, made her a reference, empowered her in diagnosis, and connected her with the patient. Guys, it's a painless exam, an exam done at home, an exam that has a reading methodology, but it has a beginning, middle, and end. And there's no way it can go wrong because it's an exam. So whether or not the patient has bruxism, you are going to perform this exam and collect the data. So this perspective beyond just the tooth makes all the difference for your positioning, all the difference. Now, here's a case I brought from BH, from Rodrigo Bortolini. The patient, Cristina Vasconcelos Ribeiro, here she is, age 61, and she came in with a complaint of dental fractures since she was young. Look at that, since she was young, dental fractures. When he mentioned the diagnostic splint exam, how did the patient react? She accepted it well, and the patient adhered to it. So yes, it was easy. For the diagnostic splint exam, he charged a diagnostic package of 450 for the splint exam and 750 for the nights of PSG, polysomnography. So his diagnostic package came to 1,200 Brazilian reals. Guys, 1,200 Brazilian reals outside the office. He wasn't sitting at the dental chair. The patient was doing it at home. Look how interesting that is. Literally, you can make money, earn with integrity while you sleep. See how interesting it is for you as a dentist to realize that it's possible to earn money outside the dental chair. And I want to bring you this clarity and this happiness that comes from implementing what is right, implementing what is necessary. It's not about overtreatment. It's not about selling what the patient doesn't need. It's not by any means about deceiving or doing overtreatment and unnecessary treatment. On the contrary, it's about bringing clarity, looking beyond the tooth, and truly understanding what the patient needs. So in his diagnosis, it was moderate eccentric bruxism. Tomorrow in lesson 2, I will explain all of this. I will break all of this down in detail. This is a live session, and the questions about the case that he brought up here, I'm not going to discuss his questions because today the focus is on differential diagnosis. Look how interesting. Remember that this patient's complaint was tooth fractures since she was young. She is now 61 years old and missing a molar, missing a premolar on the other side, all probably due to fractures, losing them over time. And she has loss of the incisal edge. She has a fracture with a restoration. There are some issues there. She has a very thick periodontium, but there are also black space issues. Some important points to note in an initial visual analysis. What do I need from this patient? In a first appointment, I need to understand what she does at night, to understand what she has so I can treat more than just the tooth, and what exams are necessary for that. How do I perform an extraoral and intraoral evaluation? This is the Mallampati exam. In the Mallampati exam, what do we have? The visualization of the posterior oropharyngeal wall, right? The wall, what we see, the uvula, tonsils, and the opening. So if the patient opens their mouth only a little, they are very likely to have apnea. And in lesson 2, I will go deeper into each of these classifications. 1, 2, 3, and 4. All right? Tomorrow. Today we brought the forms for us to discuss and the diagnostic knife exam. Take a look. Moderate eccentric bruxism. Moderate, almost advanced. There's a methodology for that. Eccentric. And it has a different treatment approach from mild bruxism. Different from daytime bruxism. Different. Now, what did he discover? Snoring present every night and mild apnea on 2 consecutive nights. Oops, the patient has already presented apnea. What is no longer suitable for her? Smooth plate, mystic plate, bruxism plate? Wow, Andrea, what if I don't do this? You give the plate blindly based on guesswork on a maybe. And you don't treat the patient. You don't treat the patient because treatment goes beyond just the plate, and there's more. On the second night, she had an apnea of 13, almost reaching moderate. So we really need to intervene differently with this patient. How do we understand that a differential diagnosis should be done for every patient? Number 1, if you don't know that this patient has apnea and she doesn't know either, because many cases of apnea are discovered by us through this methodology, you're giving the wrong plate, increasing your patient's cardiovascular risk and leaving them without proper care, not fulfilling your role as a healthcare professional. That's the first point. It's alarming, I know, but it's real. So I need to warn you because now you've seen it and there's no going back. And besides this clarity, on purpose, this clarity about who you are inside your office, what do you have? The patient, many times, whom you already know has bruxism, but you don't know the cause, you don't know the intensity, you don't know if there's a respiratory problem involved, you don't know anything, you just know there's a tooth fracture. With this patient, you also need to apply a differential diagnosis to understand the cause, the intensity, whether there are respiratory reasons or not that are leading this patient to possibly have active bruxism at that moment. Why, Andre, active at that moment? When the patient has dental wear, you don't know if when he wore it down, he came in with worn teeth, but he might have worn them down only years ago. He might be wearing them down right now. He might still be continuing to wear them down. We will see all of this in the diagnostic splint exam. So what I want to bring to you, just as Knight understood how important it is not to treat a tooth that is under occlusal overload, because if you do that, you put it at risk, as I showed you here in several articles at the beginning of the lecture, about the risk of implant fracture, the risk of losing the implant in the first year, the risk of a periapical lesion, a series of risks that bruxism brings to all of our treatments today. And besides that, the differential diagnosis changes everything. It becomes a real game changer in your practice. Look at Needy's story after the incorporation of this methodology into her daily routine. Nade is from Rio de Janeiro. She runs a clinic, does restorations, and her husband is an implant dentist. So they have a practice together and perform the vast majority of dental treatments.
I already knew she had bruxism. I thought she had more clenching than actual bruxism. She doesn't have that much tooth wear, but she's been using a mouth guard for a while now, and I was really impressed when I saw this. What you do really brings results quickly. When we show that this can improve, the adherence is really good. She immediately said, no, I want to treat it.
The patient sees what is being done. It's not just a little chat anymore. And the patient doesn't look inside their own mouth. Often they don't even realize their tooth is worn down. If it's not a front tooth, they can't see it clearly. Now, with the diagnostic splint exam, look at what the patient did. Advanced bruxism. So the differential diagnosis and the correct treatment, which is the second page, put you on a whole new level of authority. Today's approach was from a differential diagnosis perspective. And that was my goal for us to reach this awareness today. And beyond that, I want to bring you an awareness of how much each minute of your day in the office is worth. How much is it worth for you to leave your family, to leave your children, to not put the kids to bed, or not have time to go out with your grandchildren? You've missed out many times. I know, because I'm a mother of a young child. And we want to get home to put them to bed. Maybe you weren't able to do that with your children, and now you can't do it with your grandchildren either. Why? Running your practice without a clear sense of purpose, without standing out, without being able to manage your schedule in a balanced way, without valuing your own time, this makes you get swallowed up by daily life, working from 8 to 8. So we need to understand, if you've been practicing for 30 or 40 years, this is the moment. Andrea, I've already been practicing for 30 or 40 years. I haven't become a reference until now. I never will. My dear, I have news for you. And add to that, a limiting belief. What is a limiting belief? It's something you believe that holds you back. So no, that's not true. Today, BRUXISM does offer us the opportunity for you to stand out among those 426,000 CROs registered with the CFO. It's possible. Why? Not even 5% know what you just learned. So this will really take you to another level. Another case, Rafaela, 33 years old, extreme sensitivity in the lower teeth. That was the main complaint, okay? The main complaint, extreme sensitivity. When I mentioned the diagnostic splint, the patient loved it because she wanted to understand. Look how cool, the patient wanted clarity. I'm not talking about treatment, just differential diagnosis. Did she agree to the exam easily? Yes. How much did you charge? 400 reais just for the diagnostic splint exam. And what did she use? Health insurance. So the final result, centric and eccentric. Look how interesting, the patient has intact teeth. Maybe you have a patient like this, you say there's no bruxism, but when you look, one of the causes could actually be hypersensitivity caused by clenching. And very likely this patient never even thought about bruxism, or maybe the dentist didn't even think about it because it has a tip, it has a canine tip. Now, what are the next problems she's going to have? Diffraction. Why, Andrea? When examining the diagnostic plate, we clearly see the premolars with interference in the vestibular cusp. I can see that clearly. Premolars with little lines there. Look, on the vestibular cusps, what is this? These are occlusal interferences. And if this patient starts to have a clicking sound, it could be related. Interference in lateral movement, cases with hypersensitivity, cases of abfraction. All of this is connected to what the diagnostic plate is showing. So there are countless cases. I know a dentist who sent me 16 cases to analyze just within our group mentoring program. So I want you to understand there are people who are chasing after it, and now it's your turn too. Cynthia Kuna, good evening. I'm making progress too. 10 cases with a closed diagnosis at the price of 1,000 reais each. All through insurance plans, do the math. 1,000 times 10 is 10,000 reais in differential diagnosis. In a single month. What does this mean, folks? That she is progressing, that she is growing, that she is becoming a reference, that she is earning money, and all with easy appointments. Maybe you are easy in terms of the body, right? Physical. Maybe you're tired. Those heavy, difficult appointments, surgeries, exhaustion, back pain. By the end of the day, it feels like you have an anvil on your back. Not this. It's 10,000 rays with physical lightness. Molding, diagnostic plate examination, clinical reasoning. You'll use your head, you'll use your eyes less, your hands less, and your mind more. And that's why I said yes, that even if you've been practicing for 30 or 40 years, you can still become this reference right now. So with 5 to 10 patients a day, you have a huge advantage of already having these patients in the chair to be able to do the differential exam. Another patient of Fábio Miguel, a dentist from São Carlos, São Paulo. The patient is 53 years old. His name is Jefferson, and he came in with the main complaint about the crown, a lay that was frequently fracturing. So it was a ceramic, a lay that was fracturing. Is this common there? Ceramic fracturing or coming loose? When he mentioned the diagnostic plate exam, the patient Jefferson became interested. And did he agree to it easily? Yes. What was the price? 600 reais. Final result? Eccentric bruxism, predominantly on the right side, meaning a greater movement on the right side, probably associated with missing teeth. And Neutron was waiting for the result of the policy. Most likely he sleeps on the opposite side. In other words, if he makes movements on the right side, it's very likely he sleeps on the left side. Look at the chaos in his mouth. Look at the chaos in his mouth. Then you think, oh, but what am I going to do next? Should I restore it? Should I not restore it? Guys, you don't even know how the patient got to this point. Any material you use there is going to break. It's going to break. Because look at the level of wear on the palatal side. Look at the level of abfraction. Look at the level of the problem. The methodology doesn't just work for me, it works for everyone. So the same questionnaires, the same 360 form that I use, my students use in more than 20 countries. And what does that mean? That means it works. It works in my hands, it's reproducible, and the dentist can do it anywhere as well. So here are his notes that we discussed. Today is a diagnostic class, and it's very likely that the patient's saliva pH is also altered. The plaque is losing a bit of its coloration, and we see that even as the coloration fades, it's easy on the seventh day to see the tracks and the main clenching pattern of this patient. What do we notice in this diagnostic plate exam? That his contacts are very poorly distributed, that he has centric points mainly on the molars, and that he probably has some type of reflux. We can see all of this in the diagnostic plate exam, which I told you has a specific reading methodology. So nowadays, any and every patient has the profile of a patient with bruxism. Why? Because I don't know, I don't sleep with him. So even with canine guidance, we're going to have this issue. Many times, we think the following. Oh, Andrea, I'm going to put a restoration in this mouth and give a plate to protect it. Then I turn the question back to you. Number one, this palatal surface has a high chance of having an erosive pH involved here. If that's involved and you put in a protective plate, you're actually creating a pool of acidic saliva without realizing it in your patient. And what if he has apnea? You're giving the wrong plate, and on top of that, you're adding acidic saliva, making him lose his incisal edge even faster. You're doing two things wrong. And by the way, the patient won't necessarily use the plate. And there are many patients who use the plate and still don't fracture their teeth. So the plate does not reduce occlusal force. At best, the plate is protective. And when is the patient actually using it? Now I've shown you two reasons why this patient shouldn't immediately receive an occlusal plate. A flat, smooth plate. A plate that in the past we used to call a myorelaxant because it was believed to relax the muscles. Today we know it doesn't relax the muscles anymore, which is why we no longer call it a myorelaxant. Now, Larissa, a prosthodontist, also used to believe only in the plate. So what happened to her when she understood the methodology and applied it in her practice?
Doctor, am I going to have to use this mouth guard for the rest of my life? And I used to fit that mouth guard already worried that the patient would break my work. After learning Dr. Andrea's DTC method, I started to see bruxism and clenching in a completely different way. The number of cases I recommended it for doubled. So now when patients come to me, I see things differently. I charge 200 reais for the bruxism consultation and 450 for the diagnostic mouth guard exam. So now I am the go-to person for bruxism in my city and my region. I've already seen results with the diagnostic mouth guard, with the treatment, and with follow-up. So I've managed to attract many patients and many referrals, which is also the most important thing when you are respected in the field.
Guys, this is priceless, truly priceless. Tomorrow in lesson 2, you will actually see the step-by-step of how to increase your revenue, even if you do not charge for that first consultation, or if you work with health insurance plans. I want to invite you to have this vision that goes beyond just the tooth. Take a look at the plate, the flat plate, the old so-called myorelaxant plate, bringing the jaw a little further back. And here I am showing you the connection between obstructive sleep apnea and hypertension, cardiovascular risk, and all the problems we may face as healthcare professionals. Let's take our place. Our place as healthcare professionals, our place in caring for the patient, our place in the oath we took when we graduated. So become that reference dentist in your region. Come to the event. It's spectacular, 100% online, free. I want you to have this 360-degree vision. I want you to truly be part of this movement and to change your perspective. This will bring results, both financially, as I showed you in today's class, and in terms of professional fulfillment, in fulfilling your purpose as a dentist. So in every area, it's about taking care of the patient. And this applies to all fields of dentistry because the patient has changed. So it's the patient who's already in your chair. Don't forget that. The event is 100% online and free, but you need to register. Enter your best email, put your WhatsApp so you can watch classes 1, 2, and 3 that I will send to you. Tomorrow, class 2. The link is here in the description and in my Instagram bio. Tomorrow, class 2. Only those who are registered will receive class 2. If you also type the word BRUXISM here in the comments, you will receive the link to register. Enter your best email and your WhatsApp. Be careful with scams. No one will contact you with a miraculous, unique, one-day only super offer. Right now, at this moment, okay? That's not my team. That's not me. Be careful with that. Only accept 2 authorized people from the WhatsApp group. On Instagram, my Instagram, the link in my Instagram bio that is validated, and the numbers that will contact you are all the group administrators, okay? I'll see you tomorrow in class 2 together with me for this Dentista 360 degrees movement.